Thank you so much for joining us today on our next Security Middle East webinar. I'm really looking forward to the topic that we're covering today, which is essentially empowering and transforming healthcare with intelligent security ecosystems. Now, you know, hospital security, healthcare security is one of the most covered topics, I would say, within the security community. It's essentially one of the most important areas of arguably critical national infrastructure underpinning the safety and healthcare of millions of people across the Middle East. And many healthcare professionals, hospitals, and ecosystems are hit by a variety of cyber attacks and physical attacks that are disrupting entire nation states. And there's nothing more important than human well-being. So I'm really looking forward to understanding really how both Progress Security Systems and Motorola Solutions are creating safer hospitals through far more intelligent ecosystems, combining unified communications, AI-powered surveillance, and a variety of Motorola's advanced tooling. So as always, my name is Daniel Norman. I'm the chairperson for the sessions and the webinars, but I have the pleasure of introducing three speakers today. First speaker is Ahmed Rage, who is the sales manager at Progress Security Systems. He has a tremendous amount of experience within the security industry. He brings deep expertise in delivering integrated security solutions tailored to complex environments such as healthcare, government, and critical infrastructure. Our second speaker is Kamal Laban, who is a regional sales manager at Motorola Solutions. Again, he is a seasoned security and sales leader with over 16 years of experience driving strategic growth, especially across the Middle Eastern regions. He plays a pivotal role in advancing intelligent security ecosystem through trusted client relationships, solution-led selling, and a deep understanding of regional market dynamics. And our final speaker is Michelle Dow, who is a pre-sales engineer manager at Motorola Systems. Again, a tremendous amount of experience in the space, especially within the Middle East, and he brings a wealth of technical expertise across physical security, networking, infrastructure, and storage systems. So we have a stellar panel of speakers that are going to be exploring how we can transform hospital safety with intelligent security ecosystems. And as always, if anyone has any questions or comments, please do add them to the question pane at the bottom of your screen, and we will endeavor to answer the questions at the end of the session. Okay, moving on. Now, my opening question really, I'd love to start with yourself, Ahmed, is healthcare facilities are facing evolving security threats, from physical violence to cyber risks. As a system integrator, how do intelligent security ecosystems transform hospital safety compared to traditional setups?
Thank you, Dan, for the introduction. I would also want to thank our partners, Motorola Solutions, for joining this webinar. Allow me to welcome Kamal and Michelle.
Thank you.
As of your question, traditional security systems typically involves siloed systems, CCTV, access control, and radios, all working independently. The lack of integration leads to blind spots and slower responses, which can be dangerous in a fast-paced healthcare environment. Intelligent ecosystem, on the other hand, bring everything together: AI-powered surveillance, access control, communication, and monitoring into one cohesive platform. The result is a shift from a reactive to proactive security.
Thank you ever so much, Ahmed. And as a follow-up question, the relationship between your two parties here, and I'd just like to explore that. And as a leading system integrator, especially in the UAE, why did Progress Security Systems choose to partner with Motorola Solutions, especially for healthcare security projects? And what makes this ecosystem especially unique?
It's a good question. So Motorola Solution is not only a pioneer or a lead for the security system manufacturing, but also their ability to provide end-to-end ecosystem aligns with our commitment in progress security for delivering a resilient and future-proof security. Their ecosystem is built on interoperability, reliability, and scalability, three things that are vital for healthcare clients who cannot afford integration headaches, and which we as a integrator deeply appreciated. Motorola's focus on predictive analytics complement our expertise in mission control deployment, and together we provide not just technology, but a strategic safety net for hospitals.
Thank you very much. Now, I'd love to move on to our first segment, which is covering modern challenges in healthcare security. And my first question for Kamal, I'd love to come to you, and it's around, beyond physical threats, what emerging risks, for example, cyber attacks, data breaches, etc., are hospitals prepared for this kind of attacks, these emerging risks with legacy systems?
Well, Dan, thanks for asking this question and bringing it up. Well, as you may notice, we're living in an era of vast type of security threats nowadays, and that aren't always related to physical security. However, the results of these threats, if they're successful, might put the physical security systems into huge risk of vulnerability. So the type of threats varies between the cyber attacks, poor IT policies could be, insider threats, or even the resilience of the IoT equipment. So I would say the combination of the mentioned threats would definitely increase the possibility of the breach. So the biggest advice goes to the medical sector to enhance the policies, the IT policies in this regard. That would bring the measures down on the practices, the normal practices, to prevent such type of threats or breaches to be successful.
Absolutely. And speaking from experience here in the UK, the NHS and many other interconnected healthcare systems are frequently attacked by nation states, organized criminal groups, etc. So it's not just a Middle Eastern centric challenge. It's a global one
It is a
that we
global.
see. And just a follow-up question for you, Michelle. How do siloed systems like perhaps surveillance, alarms, radios, how do they create blind spots during emergencies?
Thank you, Dan. So I would say multiple drawbacks appear when adopting a siloed-based approach. I could easily identify five major ones. The first being a delayed response due to the lack of integration. So these systems do not communicate with each other. The second being the lack of situational awareness, which is very important in emergencies because there is no single person with that can oversee the full picture. The poor communication across teams, so especially during emergencies when some abrupt changes to plans might happen, poor communication will definitely a big issue. There is no centralized incident or logging mechanism where you can do investigation later on and see for audit. And finally, the reduced effectiveness for the staff, especially during drills and emergencies.
Yeah, it's really interesting point, Michelle, because when human lives are at risk, it raises the urgency, and dependency on these types of technologies becomes even more important. So Kamal, I'd love to understand or perhaps hear from you if you have any real examples where outdated technology perhaps delayed response times during a crisis and what that meant for the organizations that were involved.
Yep. Well, then to continue on what you were mentioning about the criticality of the situation, it was actually an unfortunate situation I would think about, or an example when a fire alarm was triggered in one of the medical facilities where the access control doors were automatically released as per the civil defense policies. However, that department specifically was for the Alzheimer patients, and where patients shouldn't be allowed to be left unescorted. So during that time, luckily that the alarm was triggered by a minor smoke detection. No major fire was happening. However, not being able to accurately identify the number of patients that were evacuated or still in the department remaining in there has delayed the search for who's left behind. And again, I would say luckily, no one was harmed by that incident, but solutions are there to identify the movement and the number of people present within a limited space. So such solutions, if they were in place at that time, would have definitely improved the response time of the staff, reducing the panic at that time, and of course, increase the efficiency of the fire department reaching out the place and helping in the evacuation. So that was one of the operational examples that I would think about in such type of incidents.
Absolutely. I think there's clearly operational risks that need to
Mhm.
be managed or mitigated here,
Yeah.
alongside risks to, you know, the well-being of patient care, which is critical.
Exactly. 100%.
And Michelle, you know, I'd love to explore perhaps the compliance risks as well, because, you know, how does fragmentation increase costs or compliance risk for hospitals, in your opinion?
Yeah, so let's briefly explain what fragmentation is. It usually refers to the lack of coordination among providers, departments, and systems within an institution. When it comes to increased costs, this is mainly due to redundancy and inefficiency in the system, whether it's on the IT or administrative duplications. You know, each system requires separate licensing, tracking, maintenance, and training. To staff inefficiency, because in those situations, usually staff, they try to find workarounds, all these disconnected and gaps to try to find manual processes to fill in all the gaps. And of course, if you have also a high turnover in terms of employees, in this case, your learning curve for new employees becomes much, much higher, hence your cost goes higher. Regarding the compliance and legal risks, definitely there is always inconsistent documentation between all these systems. So there is a risk of data breaches and unauthorized access, and there is no audit trail because the data is not really integrated, and it's harder to prove the compliance with any regulation.
Thank you. Thank you very much. Now, I'd love to come to our first poll. It's always interesting to get the perspectives of our audience. So our first poll here is, what is your biggest healthcare security challenge? Is it A, staff and patient violence, B, data privacy, C, slow emergency response, or D, system fragmentation? You can click on one of these options. We'll give the audience maybe 15 more seconds to answer, and then we can review the poll at the end of that time. Okay, wonderful. I can see some answers coming in. Maybe just a few more seconds from the audience, and then we can go to the answers. Perfect. There we go. So wow, I can see that the data privacy is probably the clear winner there, with slow emergency response coming in second, and then staff and patient violence in third. So, you know, clearly the data protection is pushing quite high up the agenda for the audience, which is quite interesting. And then emergency responses as an interesting alternative dimension there. Wonderful. Okay, now how about we move on to section 2, which is solving these modern challenges with intelligent ecosystems, which is wonderful. You know, we've set the scene around some of the major risks. Let's have a look at some of the solutions. And let's go to Kamal for question number 1, which is, you know, Motorola often talks about outcomes over products. How does your ecosystem solve problems that traditional vendors may miss?
Well, Dan, we have always believed that efficiency of the security systems is defined by how fast we were able to respond to the incidents or even predict the threats. That is where you would find the name of Motorola is accompanied with solutions and not even like product portfolio as we strongly believe in providing seamlessly integrated solutions that would improve the quality of outcomes and the operational efficiencies of the security personnel.
Okay, thank you, Kamal. And Michelle, I'd love to get your perspective here because I'm conscious there's maybe solutions that we would like to show the audience here. So would you be able to perhaps give us a flavor or demo how AI surveillance detects a threat? For example, maybe aggression or unattended objects in real time versus conventional CCTV?
Yeah, definitely. That's a great question. So nowadays, the conventional reactive approach of the CCTV is becoming obsolete. So we are seeing a much faster trend in the adoption of AI-based systems. When it comes to Motorola solutions, our video platform is an AI-powered platform that has a built-in mechanism, okay, and it was built from ground up to offer automated and intelligent tools for the operator at different levels. So when you combine the solution with access control, decision management, and other systems, it creates like a comprehensive security solution, as we'll see in the next slides. So as an AI platform, it's really important, but it's not sufficient by itself. Without using any kind of sensors or edge-based devices that play a key role in feeding intelligent metadata into the system. So the more data you feed, the smarter the AI engine becomes, as we'll see in the next slide. When it comes to face recognition, unlike the traditional FR at the entrances or exits of any premise, face recognition, or better we call it the face tracking, it helps us track a person of interest across a site and generates alerts upon a watch list. So even if that person moves around the perimeter or outside your premise and the face was grabbed in any of those cameras, you get a real-time alert. We complement the solution by unifying the video and access control platforms through the seamless integration that offers a really powerful tool for operators to detect unauthorized access, track a person of interest in a site, monitor door activities, receive real-time alerts, and all of these is done from a single platform. And another tool, basically, how AI will help us move into the real-time alerts is what we call the focus of attention interface, which is a key for real-time monitoring, and it uses AI to determine important events that requires operators' attention. So I'll go over it a bit in the next slide. So the focus of attention tab or interface, it uses color coding, and that is the most efficient way to communicate messages to an operator. By key coloring, I say, for example, red means alarms. A blank honeycomb represents a camera which is not operational, so you can dispatch the maintenance, so on and so forth. So from that interface, the operator can also get access to quick tools such as reviewing like a recording, sharing it, saving, etc. for reviews. Thank you.
Okay, interesting. So I'm really interested in this unification, the unified approach here, you know, taking perhaps radios, panic buttons, and surveillance mechanisms such as CCTV. How does that cut response time from minutes to seconds?
Yeah. So by moving from a siloed concept into a more streamlined integrated system, events generated at the edge devices, they populate in real time, whether to radios or control rooms. For example, if you have a wanted person, okay, within your premise, it will be displayed instantly in your control room, as well as the security guard's radio, who could be on the patrol at the time of the incident. So as I mentioned earlier as well, devices generating events are essential for the AI platform to work. One of those is the Halo smart sensor that combines up to 16 intelligent sensors in one small physical unit. So the Halo sends basically real-time events to Unity when it comes to air quality, vaping, smoking, panic buttons, aggression, and it can be installed especially in private areas, for example, bathroom, where people tend to smoke there. So hence the response time goes down to seconds. And finally, we have the other device, which is the body-worn camera. it's a key element when it comes to live streaming from the field, and it also records incidents that may arise between a guard and a patient or a person.
Okay, wonderful. And I'd like to discuss maybe the AI piece you mentioned there. So how does data analytics help predict risks in high traffic zones like ERs or pediatric wards?
Yeah. So the cameras basically have built-in smart AI algorithm that is capable of learning the scene and generating events when a sudden growth is detected. So usually the camera, if it's a quiet scene over a longer period of time, okay, then suddenly you have many people flocking the ER or a place, an event for crowd detection is actually generated, which catches the operator's attention. So we also complement this with the audio analytics AI engine. So it's not a regular recording audio, it's an AI engine that will analyze the sound patterns and generates events. For example, gunshots, break glasses, loud noises, tire screeching. So all of these events that are being analyzed in real time as audio, and the operator gets alerted. So moving on to the unusual activity detection, where it's yet another built-in algorithm that studies a person or vehicle usual pattern in a scene over an extended period of time. And it will flag what is unusual. For example, if we have in a parking lot, cars usually drive slowly, but then suddenly we had someone driving super fast. So that event will be flagged as an unusual data. And let's jump to the last part, which is the dynamic privacy masking, which ensures privacy is met. I've seen someone comment, a lot of people commented about privacy. So privacy is met without compromising safety by blurring people or vehicles in real time, with the flexibility, of course, to lift the mask during any kind of investigation.
Wonderful. And, you know, I'm taking on board everything you're mentioning here, Michelle. And in the back of my mind, I'm thinking, you know, many hospitals are, you know, quite old. You know, they have legacy systems, ecosystems that are already built out. So I'd love to get your perspective, Kamal. What would the first step for a hospital still using legacy systems be to adopt this type of ecosystem, in your opinion?
Frankly speaking, Dan, and I completely understand the commercial or budget-related challenges that comes with the necessity of upgrading the security systems. And sometimes, you know, in the real world, we really find it unfortunate that we don't go for the upgrades unless something has already happened. But as a first step to really start, I wouldn't think or go beyond what Michelle has mentioned on going into an AI platform. So as a first step, I think shifting the existing video management softwares that are existing on-prem into an AI-based platforms capable of integrating the existing cameras, and that's where like the help of the solution would be not ripping off everything and then changing it. You know, just keep your investment, utilize what you got on-prem, and upgrade in the background what you got as a software to make things much more AI enhanced. And by then, your the hospital's previous investments in the security systems infrastructure is protected, while upgrading the software into a smarter and AI-equipped application. Having said that, and making such a type of upgradation will definitely tick a lot of boxes of what Michelle has mentioned, and of course, bringing things into a higher positivity in terms of response and proactive security measures.
Okay, thank you very much. Now, I would love to move on to the next segment, which is exploring ecosystem solutions and innovation. So if we move on to segment number 3, my first question goes to Michelle, which would be, how does Motorola ensure new AI tools integrate with a hospital's existing cameras, access controls, nurse call systems, radios, etc.? How do you ensure that seamless integration?
Yeah, thank you. So Unity Video is an open ONVIF platform with available API that can integrate with third-party applications. In addition, Motorola AI-powered hardware can accommodate existing cameras to migrate them or shift them from standard cameras into becoming a smart device. So there is no need for a rip and replace approach, as we will see in the next slide about appearance search. So by integrating all the existing cameras, those devices, they become smarter. So you can benefit from all the AI tools that we have seen and explained so far. And more importantly, the appearance search, which I'll briefly explain in the next slide. When it comes to appearance search, basically, it's a very smart AI tool that allows the operator to search for a person or vehicle of interest within a site using different criteria, whether you have information about clothing, whether it's a male or female, or whether the vehicle is a bus or a truck or a car. So all these criteria can be used to basically generate alerts, search for previous appearances, and lastly is the uploading the picture of someone into the system, especially like if the police comes in, say this is a wanted person, we would like to see if this person has been on site or if he's gonna come in the near future. All the operator needs to do is just upload the picture and then the system will come into an alert mode.
Okay, wonderful. Thank you. And you know, I'm conscious there's a lot of attendees on the call today that will likely have to make business cases for this type of material and solutions. So Kamal, I would love to hear maybe some, you know, cases where this ecosystem helped hospitals reduce incidents or improved staff confidence.
Well, then I would actually remember a case that we always had to interact or like bring up as an example, where, frankly speaking, I understand the emotional frustrations that could be happening in the hospital environment, especially in the ER. But at that time, it was a patient's relative that who has initiated a physical attack towards one of the medical staff members upon receiving the bad news. So again, we understand it was emotional, but that is something unusual event happening on scene. So using the AI and appearance search features that Michelle was talking about has helped detect that abnormal behavior of the attacker, and along with the features that was stated, it has helped going into very specific selection criteria into this for the search of that person, and overall this has reduced the buffer time of the search by 92%, and accordingly they were able to identify the location of the attacker, and which happened that they were still within the physical boundaries of the hospital. All of that has happened, and we are still talking about the identification side of the story, where that suspect was identified. However, on the immediately a clear snap of the same suspect was sent and shared to the Motorola communication devices of the security guards that they were present on-prem, and they were able to arrest the running suspect again within the physical boundaries of the premises, and that has formed a big change in the response time, where suspects were not able to leave even the prem, and we were able to identify and arrest on immediate basis.
Perfect. Thank you. Now, we've got time for our next poll, which I would love to go to now, which is as following. What's the biggest hurdle to upgrading hospital security systems? Is it A, budget constraints, B, legacy system compatibility, C, staff training or adoption, or D, uncertainty about return on investment? So again, we'll give this maybe 15 seconds or so. Please do provide us with your answer. And then after the allotted time, we'll come back and review the answers. Okay, I can see a number of our participants answering the questions. So thank you very much. Perhaps 5 more seconds, and then we can go to the review. Perfect. Wow, I would say that's a pretty even spread between the 4 answers there, between budget constraints, legacy systems, compatibility, awareness, and uncertainty about ROI. So perhaps a lot of challenges that we might want to discuss later, maybe one-on-one with the Motorola Solutions team or with Ahmed as well. Now let's move on to segment number 4, which is looking at Progress Security Systems' role as an integrator. So Ahmed, I'd love to come to yourself here, with the first question. Hospitals operate 24/7, constantly around the clock. We're protecting lives, saving lives, in quite a fluid motion. And that means that any downtime can impact, the health and well-being of patients. Based on your experience integrating complex security systems in critical facilities like energy plants, data centers, or maybe even government sites, how do you approach phased deployment to minimize disruption in such high stakes environments?
Good point, Dan. So it is all actually about balancing between risk and continuity. So I would say that phased deployment is the key. In high stakes environments, as you mentioned, such as data centers, power plants, secure government sites, and certainly in hospitals and other healthcare sectors, the downtime simply is not an option. So our approach in Progress Security is always to do a proper project management, assess the risk factors, and then doing a phase planning for the project implementation to avoid any disruption of the service while having the facility on production. So we begin with a site audit to identify the critical zones, patient-sensitive areas, and the key operational workflows. And from there, we deploy in modular phases. And these phases, we often doing it after working hours or during low activities period in order to minimize any potential impact on the current operations. We also run parallel testing after implementing the system, where the new system the new system is running in parallel with the legacy system. So if anything goes wrong, we can instantly fall back to the legacy system without disturbing the operation.
Thank you, Ahmed. And from your perspective as a security systems integrator, what is the most critical success factor when upgrading from legacy to newer systems in healthcare environments?
So I would say interoperability. So in our experience, the most critical success factor is to able to integrate new technologies without disrupting existing hospital operations, since we're talking about healthcare, but this also applies to all sectors. In healthcare facilities, which often runs on complex layered systems, a mix between legacy video surveillance to isolated access control platforms. So in Progress Security, our role is to bridge these gaps to ensure that the new solution, like for example, Motorola AI-powered surveillance and unified communications, can be deployed without starting from the scratch. We give the priority here to the site-specific planning. So if we are talking about doing an audit to the current infrastructure or identifying the critical zones, in order for us to tailor a solution that actually satisfy the client requirements when it comes to the security systems, and in addition to that, to comply with the local regulations. So that's include building and redundancy, as I mentioned in the last point, having the legacy system and starting the new implementation in parallel with that to enable parallel operations to ensure a smooth handover.
Okay, perfect. And right, so an organization invests and they install these solutions. let's think about post-installation. How do you track return on investment on these types of initiatives? For example, faster response times, fewer breaches, etc. What's your opinion on that, Ahmed?
Return of investment, it is a very important point to any of, let's say, of the clients when it comes to the budget. And of course, they want to see results and to have a long run investment. In order to achieve this, we work closely with the client first to identify a clear KPIs to what they are expecting from the system. Things like incident response time, false alarm reduction, system uptime, and security time efficiency. And then after going live, we use like dashboard analytics from the unified platform, such as the software that Motorola is providing in their unified solution to measure the improvements. Like we will be measuring this KPI that we discussed with the client and prior to the implementation. For some of our recent projects, we achieved a 40% drop in false alarm. In another project, we saw a 25% improvement in response time. These are not just percentages. These are translation and the science of how the unified ecosystems can actually improve the results, provide you with an efficient solution, and definitely it is a worth ROI.
Okay, wonderful. And would you be able to share a recent UAE project in a mission critical environment where your integration of a unified security system led to measurable improvements, such as reduced false alarms, faster response times, and improved operational visibility? And I'd love for you to bear in mind, how would those principles translate to healthcare?
Absolutely. Despite that, I can't share the name, of course, but I can share with you it is a major security facility implementation, mission critical site, where operation continuity was non-negotiable for us, for the client. We deployed a unified security system. This system includes surveillance, access control, intrusion detection, and entrance systems to the facility, and bring all this into a central command dashboard. Before having this project, the client had a legacy system where security teams relied on scattered alerts and manual checks. After integration, false alarm dropped by 40% due to the AI-based filtering. Incident response time improved by 25%. This thanks to the automated alerts and live video verification. The operational visibility increased, and the supervisor could monitor all sites in real time. The result, more efficient, confident security team, and a resilient, future-ready facility. Considering this two hospitals, the principles are directly transferable. What applies there applies here, because by the end of the day, you're having a hospital or a healthcare facility where you want to have a continuity in operations, and in the same time, you want to reduce the false alarms and increase the response time. So in healthcare, like critical infrastructure, you need real-time awareness, rapid response, and minimal disruption. Imagine applying the same unified system that I just spoke about to a hospital. You will be having a security sees a fall or incident in a corridor by the AI alerts that popping up where Michelle just showed us in the VMS. A nurse will be notified instantly, and the supervisor will be able to pull live videos to assess the situation and take the right decisions.
Perfect. Thank you, Ahmed. Now, moving on to the final segment of the presentation today, which covers collaboration and the future outlook. I'd love to bring Kamal and Michelle back into the mix here. Motorola's ecosystem solutions aren't one size fits all, especially in healthcare. How do you collaborate with integrators like Progress to customize these tools for specific hospital needs, whether it's AI surveillance thresholds, emergency response workflows, or interoperability with existing systems?
Well, Dan, as you may see, the structure of the Motorola Solutions ecosystem, you will be able to spot the need of the necessary upgrades, maybe to move forward, where the core of the systems would be existing and multi-layers of upgradation would be happening following that. So being able or being an open architecture, having the open architecture infrastructure, this provides our partners like Progress Security the flexibility to scale up the infrastructure of the end customers in an efficient manner. And if you allow me to quickly add a quick comment on the polls ROI, which is in line with what Ahmed mentioned, the audience scored like 33%. And it's their right to know, like, if we are going forward in the upgradation of our systems or enhancing our security systems, what is the ROI? So as a quick comment in here, and in the healthcare sector, we're dealing with protecting lives practices. So applying an AI capable security systems features fitting the requirement of the hospital or the medical center would surely enhance the quality of service, which is the core of their, I don't want to call it a business as much as it's much more the core of their mission. And supporting that mission is crucial in applying the upgraded security systems. So that the facility is once the facility is having such type of upgradation, it would be what they are providing to their customers in this case would surely improve the quality of service. And here we're talking about a reduced response time to incidents, or even applying proactive measures as per the AI features that Michelle has mentioned in the previous slides. Additionally to the presence of such AI-empowered security systems, which should reduce the vulnerability of the existing infrastructure, meaning the facility will end up having less IT threats that we all here on this webinar might agree that it comes with high cost in case failures are happening in the IT infrastructure. So having an enhanced physical security works in support of enhancing the cyber security measures, and both practices, they complete each other. So if we think about what we're paying towards upgrading a physical security, definitely we'll be looking on the long run on a quite substantial amount of ROI once we have a protected overall infrastructure and premises. So that was my comment on the poll. Thank you.
Thank you, Kamal. And I'd love to get the integrator perspective here by coming back to Ahmed. What's your advice for UAE hospitals still relying on reactive measures to start their proactive security journey?
Then my advice is simple. Start with a vision, not a product. So don't ask what camera should I buy, but ask, how do I make my hospital or my facility, if we're speaking in general, smarter and more responsive? Begin with a security assessment, get the guidance from a security integrator or a consultant to identify your biggest risk and gaps, and then partner with experts who understand both technology and operations. Take it a step by step, start examining the system and try it. For example, Motorola Solution, they got their experience center here in Dubai, where you can actually experience a unified solution, gathers different systems such as surveillance, access control, radios, and so on. Then the client can pilot a unified comms system, integrate one ward or one partition of their system with an AI surveillance and measure the impact, see the results. So because the journey of the intelligent security, actually, it doesn't happen overnight. It is not just implementing a system. By the end of the day, the system is just a tool. It is actually how every step you take toward this. It is, by the end of the day, it is a concept. And at Progress Security, we are ready to help hospitals to make that shift from being reactive to more resilient. And we believe to be or to have a proactive security. And it is not about spending more. It is actually about spending smarter to protect lives.
Thank you, Ahmed. That brings us quite nicely to the final area or element of this webinar, which is, the live Q&A. And I can see there's a couple of questions that have come filtering through already. So I'll try my best to summarize the questions and point them towards the speakers on the call today. So question number one that's come in, it's around the enhancements or advancements, should I say, in intelligent security ecosystems. How can these technologies be adapted for alternative sectors, perhaps residential buildings or community areas, to improve safety, emergency response, and enable proactive threat detection, all while maintaining privacy? So to summarize, there's clearly potentially other use cases here, right? With the solutions you develop. I think privacy is the main important piece here. It's security and privacy both on the same page. So who out of the speakers here would like to answer that one?
Yeah, I'll take this one. Thank you, Dan. It's a great question, actually. And as you mentioned, the solutions that we provide can be tailored and customized depending on the environment where they're going to be installed. So specifically for this, if people deploy like AI-based cameras in those premises, okay, they can detect intrusions, especially for villas or places where illegal parking might happen, people who might jump over fence, etc. Ensuring also privacy through the dynamic masking. So sometimes we need to monitor, for example, swimming pools or areas where live streaming is not allowed directly. However, using dynamic privacy masking, we can blur these areas while ensuring everything is covered. Also deploying face detection or LPR for watch lists or wanted people, all of these, as well as integrating with access control. So if we have any incident, let's say happening at the gate, we want to lock certain premise or specific doors, we want to take intelligent actions, all of these can be done. And let's not forget about the radio alerts or the integration with the radio. So if you have your guard patrolling around the premise and then he gets an alert about a wanted person or an intrusion happening somewhere, being in close proximity from that alert or incident location, he can immediately act.
Okay, thank you. It's interesting you mentioned security guards there, Michelle, because there's a second question that says, in the context of intelligent security systems and real-time operational visibility, what are the most effective solutions available today to monitor the presence, patrol, performance, and accountability of on-site security guards in, whatever ecosystem we're looking at? Is that something that you'd be able to cover?
Yeah, so I would say there is no single solution. And this question, it's an interesting question, but there is no one solution that fits all or covers everything. It's going to be a combination or integrated system between, for example, an advanced guard tour management solution, access control, live cameras, as well as body-worn cameras. So all of these, they can ensure the, let's say, the security guard accountability while keeping the operational friction low, and of course maintaining a clean record and audit logs for all the events that happened while the guards are on tour.
Brilliant. Now, two final questions from my side. The first is, can this ecosystem integrate with IoT devices as well as IT and the devices we mentioned?
Yes. So as I mentioned, Unity is being an on-VIF open platform with API. One of the IoT devices, actually, we went through it, which is the Halo Smart Sensor. That is an IoT standalone device that's already integrated with that. So if there is any specific device or platform, yes, definitely like middlewares or integrations can be developed to integrate it with Unity.
Wonderful, thank you. And final question is, Do staff in hospitals and other areas need training to use these tools effectively?
I
Thank you.
can answer this.
Yeah,
I can
go
answer
ahead.
this then. Yeah, so based on the, of course, as like any other security system, by the end of the day, it is a tool. And is a tool that it depends on the value of the teamwork and how trained the user is to use the tool. In some cases that we saw that the client will be having the feature that they are actually looking for, they just doesn't know how to use it. So of course, training is something that is crucial for any operation. For that case, in progress security, for example, we definitely during or as a part of the handing over process to any of the systems, we providing practical training to the staff or the operators who are using the system. We having, for example, a checklist or a template that gather all the requirements that the client will looking for in from operation perspective in order to have their team well trained in order to be able to use the system effectively.
Perfect. Thank you, Ahmed. Now, look, we are running out of time. I mean, we could probably stay on for far longer to explore some of these challenges and solutions you mentioned. But I would like to first start by thanking you all, Kamal, Michelle, Ahmed, for your presentation today and for answering the questions so diligently. And secondly, of course, to the audience for taking the time to listen to the gentlemen present their solutions. So thank you to everyone. And
Thank you.
I would certainly recommend exploring both Motorola systems solutions, should I say, and as well getting in contact with Ahmed and Progress. So thank you all. Thank you for your time. I hope everyone enjoyed the webinar today, and we hope to see you all very, very soon. Thank you very much.